Coming of Age is coming up next. I'm your host, Emily Echeverria. First today, we're talking about peripheral arterial disease, or PAD, with Christy Crowley from the Baptist Heart and Vascular Institute. Next, if you're looking for a way to give back this holiday season, we'll tell you how you can be a Santa to a senior in need. Finally, we're highlighting a local group that uses their creative sewing and needlecraft skills to keep older adults in our community cozy and warm. Stay with us. Coming of Age starts right now. As we age, staying active and connected to community can sometimes become more challenging. But with Council on Aging of West Florida's broad range of home and community-based services, you can stay healthy, independent, and engaged in life. From Meals on Wheels and respite care to senior dining sites and the retreat, we provide the support and connection you need to age your way. Aging is a unique journey for everyone, and we're here to help you meet your needs and thrive while preserving what makes you, you. Since 1972, we've been a trusted advocate for elders and a support system for those who care for them. Now, let's dive into the age-related issues that matter most to you. Peripheral arterial disease is a circulatory issue that affects between 8 and 12 million people in the United States. Here to talk more about the signs of PAD and how it is diagnosed and treated is Christy Crowley, a nurse practitioner who provides care to patients at the Baptist Heart and Vascular Institute. Thank you for joining us today.
Hey, yeah, no problem. Thanks so much for having me.
So what is peripheral arterial disease?
So peripheral arterial disease, or PAD, is a circulatory condition, like you mentioned, that affects the peripheral arteries in our body and limits the ability for blood flow to travel effectively to our extremities, most likely our legs. Arteries typically are hollow-shaped vessels, and so as time goes on and plaque builds up, that plaque buildup limits the amount of blood flow that can reach our extremities. Since your peripheral arteries are responsible for delivering oxygen-rich blood to your tissues, this can lead to problems with patients, especially as we get older. Things can happen like pain or something called claudication, and then it can even lead to open sores or poor wound healing, and then ultimately it can lead to amputation, which of course can affect someone's quality of life significantly.
Sure. So when we say peripheral arteries, we're talking about the ones that are farther away from the heart, or like the smaller ones?
Mm-hmm, yeah, so it includes any artery that is not in your heart, and then also mainly in your arms and your legs.
Okay.
And so your main vessel that comes off your heart, your main artery is your aorta, but there's tons of arteries that come off that deliver blood flow to really essential organs in your body.
Gotcha. So how common is PAD?
PAD is actually very common and oftentimes or underdiagnosed. And so between 8 and 12 Americans are estimated to have PAD, but again, the National Institute of Health really recognizes that it's an underdiagnosed disorder, and so it's probably a lot more common than that, and people are probably living with PAD and just don't know.
Well, who is at risk for PAD?
So that's an interesting question. So it's not the same thing as coronary artery disease or heart disease like you mentioned, but it is really similar, and so the blockages in the arteries build up the same way, and so it's not surprising that they share a lot of risk factors. One of the biggest risk factors would be age. As we age, it becomes much more prevalent. Tobacco use makes you significantly higher risk. That's chewing and smoking tobacco. High blood pressure, high cholesterol. Any person with diabetes, that increases your risk for numerous vascular diseases. A sedentary lifestyle increases your risk. And then there's also some component of genetic and family history that increases your risk.
Okay. So what are the signs and symptoms? Like, how would someone realize that they have PAD?
So by far, the most common symptom of peripheral arterial disease is called claudication. That's a specific type of leg pain. Typically, patients will say things like, I'm cramping, or I'm aching, or I'm burning when I'm walking. And so the characteristic of claudication is leg pain with exertion, such as climbing steps, walking, or even exercise, that typically is relieved by rest. Although it may take a few minutes for relief after you rest. This normally occurs in your buttocks, your thigh area, your calf area, or even your hip area. As the disease progresses and becomes more severe, people can have this type of pain even at rest. And that's really kind of characteristics of very severe PAD. Other signs to be on the lookout for are loss of hair on your legs, shiny or taut skin, discoloration of the lower extremities, and sometimes people have open sores or even small wounds that are really slow to heal.
Okay. So how is PAD diagnosed?
So I think it's important to note that the symptoms are also often ignored by patients because, as I mentioned, the most common is leg pain. And as we age, we kind of dismiss it as normal aging aches and pains. Or there's lots of other reasons to cause leg pain. So there's arthritis, or there's even venous insufficiency in the legs, musculoskeletal injuries, diabetic neuropathy, or even sometimes back pain can lead to leg pain. So the first step is always to have a detailed conversation with the healthcare provider if you suspect something like this. The nurse practitioner or the physician that you see will have kind of a really detailed discussion, go over what your symptoms are, evaluate your risk factors, do an exam, and then if they suspect peripheral arterial disease, the next step is typically an arterial ultrasound, which is just a very non-invasive and quick test that evaluates the blood flow in your legs. Sometimes they can also do a test called ankle brachial index. What that is we measure the blood pressures in your legs and your arms, and then we compare the two to see if there's a significant difference. Okay. If that is abnormal, there might be further imaging required, so a CT scan or an angiogram, things like that, and then a referral to a vascular doctor, such as an interventional vascular cardiologist or an interventional radiologist or cardiovascular surgeon.
And how is it treated?
So the mainstay of treatment for PAD is going to be healthy lifestyle and modifications and dietary changes. So things like quitting smoking. We have tons of assistance programs that we can help people quit smoking now. So patches, gums, social support systems, and even medications that are really successful. So that's a big one. Other medicines that might be prescribed are controlling risk factors, like I mentioned. So controlling your blood pressure, so blood pressure medications, or in diabetics, glucose lowering medications. There's also really a high focus on cholesterol medication because those plaques are oftentimes built up of fatty deposits. And so statins have been shown to significantly reduce cardiovascular events in people that have PAD or even diabetes. So that's a big category of medicines we prescribe. Other medicines can be things like antiplatelet agents, aspirin or Plavix. There's sometimes even anticoagulants used or blood thinners. And then we have a couple medicines that can help relieve the symptoms but don't really do a lot for the actual blockage. By far the most important part of peripheral arterial disease treatment is a walking program. And this seems kind of counterintuitive sometimes because people hurt when they walk and so they avoid walking. Mm-hmm. But a walking program really consists of a program where you alternate between walking and resting periods, and you walk until you kind of feel the pain, rest, and then start walking again. Over time, the patient will be able to notice that they start walking longer and longer. At Baptist, we're lucky because we have a cardiac rehab center, and so this is really typically best performed in somewhere like that. Mm-hmm. But it also can be very successful at home or in a community-based program. And so that's the mainstay of treatment. And it's sometimes difficult to talk patients into, but it really helps. And then lastly, if that is needed, there's also procedural solutions.
Gotcha. All right. Well, thank you so much for sharing this with us today.
Mm-hmm. Thank you.
Next up, we'll tell you how you can make the holidays merry and bright for our community seniors. Stay tuned.
Navigating healthcare is hard. Baptist makes it better. With convenient locations, easy scheduling, and skilled, compassionate doctors, all when you need us most. The next time you need care, let Baptist make it better. Baptist Healthcare.
The Reesburg Institute, Pensacola's Ear, Nose, Throat, and Voice Center. We welcome you to visit us at our convenient Davis Highway location in Pensacola. At the Reesburg Institute, we offer the most advanced treatment available in a calm, stress-free environment. Since 2014, we've performed over 1,000 cases in office of balloon sinus surgery, as well as septoplasty and nasal procedures using oral sedation. The The in-office procedures result in a faster healing time. Visit us and feel the difference.
Animal Allies is looking for volunteers, and there are many ways that you can help. From taking care of cats to using your computer and social media skills, any and all assistance is greatly appreciated. We have morning and afternoon shifts every day or help at adoption events. You can even foster a kitty at home. And it counts towards community service hours for bright futures. Find Animal Allies Florida on Facebook and Instagram, or go to aaflorida.org/volunteer.
Two flashes.
What's up, champ? Feel like you get taller every time I see you. Congratulations, Brandon.
Thank you.
Keeping your family healthy can be complicated. Baptist makes it better with trusted primary care doctors for the whole family and trusted specialists at convenient locations throughout the region ready to care for you. All when you need us most. Let Baptist make it better. Baptist Healthcare.
The holidays can be a lonely and isolating time of year for vulnerable older adults. Luckily, there are many organizations in our community that work together to make the Christmas season all it should be for those who can often be forgotten this time of year. Let's hear more about how you can be a Santa to a senior with Stacy Rebello of Home Instead. Thanks for joining me today, Stacy.
Thank you for having me.
Always good to see you.
Yes, I know. This is great.
To start off, tell us about Home Instead.
Okay, what Home Instead does is we provide care for seniors wherever they call home. So we do things we call ADLs, which is activities of daily living. So it can be something as simple as making a meal for someone, taking them to the doctor, doing their laundry, or it can be as extensive as Alzheimer's care or incontinence issues or respite care, or even if someone is in end of life, we can help with that support as well.
Absolutely. And so just like us, helping people age where they are, where they're most comfortable.
Yes.
So what is Home Instead doing for seniors this year for the holidays?
Well, every year, this is our 21st year doing this. It's called Be a Santa to a Senior. And so if you think about the angel tree for kids, this is the exact same thing for seniors. You know, the kids are always remembered, but I think sometimes the seniors can be forgotten. So this is our way of giving back to them. What we do is we put up trees at certain locations around town. So it can be a merchandise, or it can actually be at a private club, or it could be actually in a corporate area. So we just try to make it to where it can be accessibility for everybody. But what we do is we adopt seniors through Council on Aging, usually through their Meals on Wheels program. And then of course, some of the low income nursing homes around town. And they ask for things like socks, blankets, and of course the ones that are at home, they need more expensive things like maybe a microwave so they can heat up their Meals on Wheels, or a heater so they can stay warm. So those are things that we try to think about. What can we do to help them remain as independent as possible and to live as long as they can and age in one place? So it does go back to what Home Instead really wants to do, is to help people age in place, but what can we do to give back to the community? So that's what we do every year for Christmas.
And why do you feel this is so important to do something for the holidays for seniors?
Well, like I said, I feel like they're forgotten, but it also could be their last Christmas. And so we want to make sure that they feel like that they're being thought of, and because sometimes they're just lonely. You know, it might not be so much that they, you know, don't have what they need, but they just are lonely. And so we want to make sure that they're being thought of.
Absolutely. I know with Meals on Wheels, just the friendly visitor of their weekly delivery, you know, that means so much to them, and just gives them that little bit of love and friendship that they need. So what are some of the items being asked for this year? I know you talked a little bit about that. And where are the trees?
Okay, so the trees are at Escambia County Sheriff's Office, downtown YMCA, First United Methodist Church, and we've got one more that we just added on this year. It's Bells, Florida, off Davis Highway. Okay. We're really excited about that one. Home Instead has partnered with Bells on a state level, so we're hoping next year we can add some more Bells in. And you know, for us, it's we want to make sure that the shopper has the experience, especially going into Bells. They can go in and they can actually just grab an ornament right here, make it easy, get what they want to, have to get on the list. So for this one, it says coat or jacket for a male, medium size, and then they like socks too. So it makes it easy for them just to go straight into the store, get what they need to get for the gift, and then, of course, drop it into the box.
Right, so let's explain how that works. You go, you get the tree, you pick the ornament, it has the gift on it, buy the gift, and bring it back to that tree place.
Correct.
And put it in the box there.
You got it.
Okay.
Yep, so it's very easy, 3 steps. Pick the ornament, buy the gift, and bring it back to the box. We will do collections a couple times a week. And then on December 19th, we are going to be doing our gift wrapping party. So there's no need for the shopper to actually wrap the gift at the time of purchase.
Good to know.
Yes, they can just leave it in the bag, whether it's Bells or another store, they can leave it in that bag. Just make sure to attach the tag to the outside so we know what items are inside of it. And then when the gift wrapping party comes, then we know exactly what to put inside the gift. And the nice thing about the gift wrapping party is that we invite the community to come in, help wrap. We've got hundreds of gifts, so it's a team effort. We usually get it done in a few hours because we just have people show up and that are ready to help out. But we've also made it easy for them. So what we do is we get the elementary schools involved, and we get the nice paper grocery bags that have the nice little handles on them, but the kids decorate them. And they're so cute. And I think that's, a way for the kids to say, what am I doing for the community as well? So it's bringing in all those age levels together.
Absolutely, very intergenerational and helping kids remember that they're older adults in their families as well, too.
Correct.
During the holidays. So how can people get involved? Can anyone join in the wrapping party? I know I got to do it last year. It was a great time. There was food, a whole spread.
Yes.
It was a party.
Yep, we open our doors at Home Instead. Our office is 817 North Palafox. So we invite everyone to come in and enjoy wrapping gifts at 10 a.m. on December 19th. And it really is, it's open to anybody. So, because there is an element to, okay, I want to be able to give back, but I might not be able to financially give back. So this is a chance for somebody to, give back their time. So that's what we try to do, is incorporate all those.
Absolutely. So 21 years you've been doing this. What have you kind of taken away over that 21 years of doing Via Santa to a Senior?
No matter what's going on, the gifts are always fulfilled. And even during COVID, even during a slow economy or the weather, no matter what, it's just the season. People always give back, and it really does amaze me. But every year, it seems to we always hit that number that we're supposed to hit, and it doesn't surprise me at all now.
That's beautiful. We have a very generous community. We have seen that too at Council on Aging.
Yes. Yeah.
Well, thank you so much for coming in and telling us about this, and we hope everybody gets involved, grabs one of those bulbs, and comes out for the wrapping party.
All right. Thanks so much.
Next up, we'll be learning how one group blesses seniors through their handiwork. Stay with us.
I don't know why you're so sad. You've got a roof over your head.
Bro, you gotta stop with that depression stuff. That's a white people thing.
Escúchame, en esta casa los hombres no lloran.
You all right?
It just feels like it's coming from everywhere.
Do you want to talk about it?
Thanks for hearing me out, bro. Appreciate it.
You can talk to me if you're feeling sad.
Whenever you need to talk, I'm here, okay?
qué color? Perfecto, mijo.
Gracias. Thank you.
What's wrong, mijo?
Donating to a pet's medical care is one of the many ways you can help families in your community. Pets and people belong together. Learn more at petsandpeopletogether.org.
Caring Hearts is a group of women who are united through their shared love of sewing, knitting, crocheting, and other handicrafts. They meet weekly at the Wesco Senior Center to work on their various art forms, and they donate their handmade creations to local seniors. We're talking to group member Virginia Willard to learn more about Caring Hearts. Hello, thank you for coming today.
Thank you for having me.
So first of all, tell me a little bit about the group and how you got involved with Caring Hearts.
The group is 8 ladies, senior ladies right now. We have 8, more welcomed at any time. We meet once a week and we use our handicrafts for different things for seniors, and we give them away at the end of the month. We'll go to nursing homes and assisted livings and hand out all our things that we have made during the week, during the month. So.
And you've definitely given your items to us at Council on Aging. We've been working with you for quite some time, but why do you feel like it's important to give these items to seniors in particular?
First of all, some of them may not have a lot of support in their own homes, and so we feel like we can do that. A lot of times a little small something to them makes their day, no matter where they are, if they're at home or if the folks are in a living facility somewhere. That's a nice gift, and it kind of makes their day to have something different in their life. So, and we enjoy doing it. So.
Everyone wins.
Yeah, everyone wins. Absolutely.
So what are some of the other places that you bring the items?
All pretty much the assisted living facilities in Pensacola and the nursing homes. Homestead Village is one. There's a couple of others right now that really would like to have us come and bring things to them. Some are not as welcoming, but most everybody wants some of these gifts. So we just pick one for that month, whoever gets it for that month. So at Christmas we do make special bags with a bunch of other items in it, toothpaste, combs, things like that, and we'll take that. We have a nursing home right now, I don't remember the name, that we will donate that to it then a couple of weeks probably. So,
okay.
Yeah.
That's awesome. And you were telling me that the different women, they all do different things. So tell me a bit about the items you've brought and some of the different crafts that the different people do.
All right. Well, first of all, I will show you this particular bag. This is done by one of our ladies, and this is knit crocheting. And this is all plastic bags that you get from Walmart, your grocery stores, and she puts them all together. This is our biggest bag, and we have some small ones that we give out. This particular item is a fidget mat, and the fidget mats are for folks that have maybe some dementia, and then they can just play with these items and keep them busy.
And I know you have given those to some of our participants at the retreat where, you know, sometimes when people have cognitive decline or dementia, they just feel a little antsy, and it's very comforting to have just these different textures and these different items to kind of touch and play with and engage with. So yeah, that's awesome.
So, and we have all kinds of stuff that we'll put on those. It's kind of fun to do it too. We have what we call the adult clothes protector, and these are very, very handy, especially if you're laying in bed trying to eat your lunch. You just kind of put this around your neck and
I can
covers
use one
your
of
whole.
those.
Yeah. Well, if I'm sitting in my lounge chair at home watching football and eating hot dogs with ketchup, I'm bound to put ketchup on me, so I have one of those. We also have walker totes, and this goes on your walker. The straps hold it on. folks like to put all kinds of treasures inside of it.
Yeah, so when someone is walking around with their walker or rollator,
Right.
that's perfectly
That's exactly
built to.
what they have in it.
Excellent.
In front of you is what we call a lap pad or lap robe kind of thing, and it fits over the top if you're in a wheelchair. We have a neck protector. We have little small fidget wristbands that go around the wrist. Just anything for seniors to help them out.
Awesome. I love how they're all so specifically designed, with those particular needs in mind.
Right.
So tell me about when your meetings are and what happens at a meeting when you meet up. Are you each kind of in your corner sewing or doing whatever it is that...
We have a very small room. There's, right now, like I said, there's 8 of us in there. We're all either at the sewing machine or at the cutting table or at the fidget mat making table. We're all doing knitting or crocheting. And so everybody, there's plenty of room, and there's room for somebody else to come join us if they're interested. But we're only there a couple of hours. Sometimes we do a lot more talking than we do sewing, but
of course.
it's good for us to get out and have different friends there too. So Council on Aging supports us for that, and we appreciate it. They do bring us a lot of extra material and things that somebody's donated to them, so that's a big help also.
And can people donate if they have extra fabric or yarn? People can donate that to you?
Oh, yeah. Fortunately, we've not had to buy material or yarn. Now, there are a couple little things that we do need to get, but we have plenty, we get thread that's donated. Anything like that in the sewing world, it does help us out. Okay.
And your meetings you meet up on Fridays from
9 to 11.
At the Wesco Senior Center.
That is correct.
And so others that are interested can join and stop by, call the Wesco Center, and see if they want to get involved.
They certainly can. We'd love to have anybody who would like to participate in it. So.
Well, thank you so much for sharing these crafts with us today, and also with sharing them with the seniors in our community. We so appreciate it.
You're more than welcome, and thanks for having me.
Of course.
Yes.
And thank you for watching. Until next time, enjoy life. You've earned it.